The speaker just spoke about Eleanor Holmes Norton. Now, she did co-sponsor HR 676, John Conyers, right? Okay. Just want to make sure, but Steny Hoyer has not co-sponsored any. Okay. All right. Okay. The reason I know this because I lobby with Margaret Flowers and Kevin Cease. Okay. You guys owe them a big, yeah. You guys owe them a big. Without them, Bernie Sanders doesn't know what he knows. Alexandria Ocasio-Cortez doesn't know what she knows. Okay. Tulsi Gabbard doesn't know what she knows. I wouldn't know what I know. And I'm running for congressman in the 6th District of Maryland, and John Delaney got laughed at big time by California. Did you guys get to see that? And then he got heckled by who? Bernie Sanders, right? Does he know what he's talking about? And then Jimmy Dore, I don't know if you guys watch his show or not, but he got heckled big time by him too, okay? So anyway, Bernie Sanders, Alexandria Ocasio-Cortez, and Tulsi Gabbard needs to know what the lady just spoke about right there. If they would say those things right there on stage, on a debate stage, everybody's going to be listening because they're going to hear about Georgetown. They're going to hear about George Washington University, right? And the fact is that our health care today costs the United States of America $3.5 trillion. 330 million people across the United States of America times $4,000 per person is $1.5 trillion. Do you get me? Not, how do I know $4,000 per person? Because 90 other industrialized nations, Canada, Spain, Germany, France, England, does this already for $4,000 per person. You see what I'm saying? So 1.5 trillion. So our health care industry and our congressmen and senators are getting bribed by pharmaceutical companies, right? Healthcare companies, all these other insurance companies. Okay, I just wanted to.
Thank you. Thank you for your comments. Anybody from the panel, Walla? Go ahead and talk. It'll just.
Okay. Can everyone hear me? Yeah. Okay. Okay. I'm sorry. I wanted to actually respond.
Is this one on?
Okay. All right. I wanted to respond to the question because I understand. I'm not sure. Did Holmes Norton endorse 1384? She did? Okay. And so I don't want to put her out there. Sorry if some people feel like I was attacking her. I mean, it was focused on the fact that some of the comments she made to us, and it was a disheartening meeting for us because there is sort of a response from a lot of elected officials, and I have not spoken directly with the congressman about this, but there is from a lot of some of the congressional members who have not signed on to this, that this is just how it is. And if things are closing down, maybe the government can come in, give a little money, but instead of the government going in trying to save a hospital by throwing some money at it, how about you just change the healthcare system? If the government actually puts money into the healthcare system by putting Medicare for all in place, that saves a hospital, and it's actually costs less than keep throwing millions of dollars into a hospital that's really failing or closing.
That's right.
Hello. Is this? Okay.
Go ahead.
My name is Kevin Doby, and I just had a question for anybody on the panel. We all know that representation matters, numbers matters. What are some talking points we can give to people with a private insurance plan to kind of get them on board with this? That's it.
So the data point that I always like to give people about private health insurance is that over half of us with employer-sponsored health insurance have family members who do not go to the doctor because of fear of cost. That comes from a Kaiser Family Foundation study just done based on 2018 data. So half of us are not going to the doctor because we're afraid of cost. that $500 bill I was talking $500 bill I was talking about that a lot of people probably have opened in the mail. The reason why I had to pay it was because our family had not met the deductible yet. We have all these words, right? Premium, deductible, copay, all of that, right? The way that we have to start thinking about this is that the $500 bill, that deductible, is a weapon. It is a punishment. You are being punished. You have to suffer $3,000. You have to suffer $3,000 deductible before insurance will come to your help. That is the way you have to start thinking about this insurance, because the terminology is soft. It's easy to just kind of get lost in it. You know, it's this many premiums a month, this much copay at the doctor's office, this much deductible per year. But at the end of the day, that $500 is a weapon. And it was to teach me a lesson. Don't take your butt to the doctor. Don't make us have to help you. And it works, right? Because it makes me think like, shoot, now I'm not going to go get a physical. My wife's been on my butt about going to the doctor to get a physical. Here I am, a doctor, not going to the doctor. Because like I have more fear of the bill than I do of like what's going to happen to my own health. And we've all been there, right? Everybody who's got employer-sponsored insurance knows this fear. But that number is 50%. Over half of us are not going to the doctor because we're afraid of the cost.
Okay. Ellie has a comment.
So I just want to add one thing here. And that's that one of the talking points it's important to use is that you're being sold fear. And the fear is causing you to ask for what you don't need. And they've undermined the relationship of trust that you were supposed to have with your caretaker, that when you have reflux or discomfort after eating, and they tell you, listen, you don't need a CAT scan because you're just having indigestion. Or this is a common headache, you don't need an MRI. Because you know what, they love it when you come in and you say, I want an MRI. You know why? Because even if it's not covered, you're gonna get billed for it. And even if you don't need it, you're gonna get billed for it. And they love to say, aggressively treat pain. You know why? Because they can sell you drugs, even if you don't need it. You might even become addicted. Doesn't matter, because there are pain management clinics, and they'll give you more as long as you keep going and paying for them. So the pharmaceutical companies and the hospital systems are implicitly involved in this undermining based on fear. And it's creating an economy that is unnecessary to perpetuate. And we, as consumers, okay, we're doctors, a little different. So we look at it and we're like, I'm not going to deal with that. But the people that are not experts in that field, it's just like I don't do plumbing. So if they tell me I need a plumber at least once a month, I'm gonna probably go ask the plumber for the advice. It seems very, very similar. There's a lot that we are being sold based on fear. Mm-hmm. And exactly the same as the issue of copay has become, oh, we can't do anything about it. Well, that's ridiculous. How can you calculate what I need to pay you per month for coverage and then tell me that I got to pay another advanced amount of dollars in order for that system to kick in? Who made that up? Well, a brilliant businessman who's the CEO of the insurance company.
Thank you. We have two questions here, but Walla, go ahead, please.
I just wanted to say one thing, and there's a bigger part of this that we as advocates need to put out there. Now, first of all, I just want to make a side comment. You think you have good health insurance until you get sick. So that's the reality for all of us. Everybody say, I love my health insurance. Then you become really sick and you have to pay copay, can't pay this, can't pay that. But let me just say this. The bigger piece of this is Medicare. And the reason why is because when I was even running in the 25th district, which is down the street and around here, people would say, well, Medicare has all these problems and the Medicare doesn't cover this and Medicare doesn't cover that. And that's part of it. Like someone says, well, I've got private insurance. I don't want Medicare unless I have to have it because it doesn't cover things. Well, one of the main things that was set up here is Medicare will change. And that's something that we need to really get out there, that it's not going to be the same program that it is today. Sometimes it's not effective because of the actual involvement of private insurance, which is impacting the actual Medicare system. Medicare will change, and we need to put that out there. Make it clear. it's not going to be the same program. So, I'm talking to a friend who's like, Medicare only gives $100 and doctors don't get paid. No doctor is going to support Medicare. Well, Medicare for all. Well, we got doctors on the stage here, so they're wrong. But even so, Medicare isn't going to pay that the same way they are with a full Medicare for all plan. So we need to put that out there, especially for those who are currently on Medicare. I know a lot of those who are on Medicare are very frustrated with the process, especially the prescriptions, Part D, but telling them it's not the same program.
So
Thank you, Wawa.
I
Alex?
know we've had a few comments on this, but I agree with everything that's been said. I'd like to sort of reiterate that what our job is to take this message out to people. And so we should actually follow some best practices with how we talk about this. And what that is exactly as you said, we need to tell people what it's going to do, what you're going to get. The solution is what we talk about. Don't be defending. Don't be on defense. They're coming at us, but we don't say, they say, how are you going to pay for it? We don't get into the weeds on that. What we say is, we're going to create a system that has no copays, no deductibles, no premiums, where you can see any doctor or provider that you want. We're not replacing Medicare, we're improving Medicare. We're going to take a system that people love and we're going to fix the parts of it that they don't love. We're going to add vision, we're going to add dental, but it's all of the positives. Oh, and did I mention that you're going to save money? And you can't be denied care. So this, agreeing with everything that's said, we should always be telling people what they're going to get. Because what people are afraid of is losing something. What they're afraid of is not, they don't love their insurance company. Literally no one, 0 people love their insurance company. Right. No one is like, my dear Aetna, how I love you. Let me count the ways. They hate their insurance companies. They might like their provider. They're terrified of losing the crumbs that Wall Street lets us have. They're terrified of dying because we know that the sociopaths in the C-suites at these companies will let us die.
That's right, they do.
Insulin, the patent for insulin was sold for $1. $1 by some Canadian doctors, actual researchers. Then it made its way to America. Now it's increased 400% in the past decade. Do you know how they find the price point for insulin? They figure out exact amount of money where a few people are going to die so that everyone else is terrified enough that they'll go bankrupt to pay for the insulin that they need to live like everyone needs oxygen. Think of the mindset. Think of the sociopathy that it takes to do that. And then it makes sense why people are scared. We should be scared of the people driving that system. Right. But we have to sell hope. We have to say, yes, this is formidable. And I think that Steny Hoyer will definitely join on Medicare for All once we make the din and the clamor and make it clear that no one cannot be with Medicare for All.
Yep. We're almost there.
To just sum up what President JFK said, I'm not gonna take the whole thing, but it's because it's hard. We're gonna do it because it's hard. No one ever gets a big plaque on the wall for maintaining the status quo. Oh, thank you so much for doing nothing. You really did a great job doing nothing. No, we put a man on the moon and did the other things because it was hard. We're going to create a system that covers every person in this country because it is hard, but standing together, we're going to do it. Selling that hope is the key part.
I have to add.
Okay.
I just
Dr.
have to add.
Gomez.
Can I add something here real quick? Sorry. So it's hard to believe that it could actually be more cynical that you're putting it out here, but it's necessary for people to know that CEOs of insurance companies, as a for instance, their compensation is calculated based on patient lives. Did you know that? So this brilliant health economist that taught me actually gave me this understanding. That's out there. That's information you can find and you can verify. It's just far too creative for me to come up with it, but that's what's actually happening. The other thing that is in the way of Medicare, and specifically Medicare and human lives. So estimated $5.8 trillion overall costs of all health in America. Ridiculous, right? It's not sustainable. At some point, it's going to be done because we can't sustain it. Meantime, the folks that are not addressing it don't care because they're going to write it out as far as they possibly can anyway until it collapses. If you look at our health outcomes at our cost, which is higher than the rest of the industrialized world, our outcomes are worse, far worse than most, or if not all, with universal health care, and some without. All right? That's out there. That information's out there. That's for you to use. When you look at our poorer lifespan, you'll find that for all the criticism around Medicare, after age 66, our lives extend in the same way as other health systems that have universal coverage. Before that is when we are less likely to survive to the same age or health state. Consider that.
Is this on? Okay. My name is Jim McGee, and I am actually with the Labor Campaign for Single Payer. Unfortunately, I arrived a little bit late, so my banner couldn't get back here behind, so all the people on Facebook could see it. And I don't know where it wound up. But I want to address the gentleman's question about how you talk to people with private insurance. My day job is administering one of those plans. And I see on a daily basis how it doesn't work. But I also see that for many people who think it works, and I spent a lot of time talking to union members about this. And to give you an example, I was talking to an audience, and this one woman seemed to be coming around, but she said, you know, I finally figured out how the system works and how I can get care for my kid's asthma. I don't want to change. So this fear of change is real, and we need to confront it and address it. And the way that I try to talk about it is, as Alex kind of said, talk about the positive. Imagine our lives when we can take our health care for granted. And we don't have to work to get health care, but we get health care so we can work. We don't have to factor, healthcare is not a factor in decisions about who we work for or about how many hours we work for or when we retire or when we take time off if we want to go back to school or just a mental health, extended mental health break. Imagine that. And somebody pointed out another factor that I hadn't even thought of until fairly recently. Imagine that healthcare is not a factor in our marriage relationships. And how many people are tied to bad marriages simply because of the way the current system works? So that's how I would approach that. I hope that helps.
Great, thank you, Jim. So we have one more question over here, and then we'll turn it over to stories. Let's let Walla comment on that.
I just want to actually add to that. One of the biggest things is entrepreneurships. Entrepreneurs are not able to fully do what they want because of healthcare costs. I know so many entrepreneurs around me that are always reaching out to me because I help some businesses, and they're always saying, I want to do it on my own, but I have to stay at my job so I can get health care, because once you get out of your job, you're going to have to go into that ACA market. That's a mess, and you're going to have to pay $400 or $500 a month for health care, and if you don't, and even more than that, even more so, recently I was talking to someone that, they lost an election, and they were telling me how basically they are no longer have this great health insurance with the government. So they want to go on their own and do all their things, and they do that, but they have to pay $2,000 a month to kind of go around, do consulting, do all that, $2,000 a month because they have a chronic illness that they need care. So that's another point there. So you're just talking about relationships. Let's talk about people who want to actually go. You know, America loves their whole do what you want, go out there and be who you want to be. Well, you can't do that in our system because you can't afford health care.
Okay. Okay, so we're going to take one more question here, and we also want to comment that Howard County couldn't hire enough teachers because of the increase in their healthcare costs, right? So it's trickling well into our economy. Question, please, for the panel.
My questions are about how are we going to win this thing? And two thoughts. The first is, this is a huge church, and in this church, I live 20 miles away. I can only think of one family I know that attends this church, and I know that it would be good for them to be here. And I wish, I'm lucky to hear these poets and experts telling the truth about what's going on in a way that I can understand and other people can understand. And it would be so beneficial if this whole church could hear it. That's just one thought. And this other thought, which in my mind is related, is this. Of the candidates, all the different candidates and all the different elections and levels, in the presidential candidates, as far as I can tell, a lot of them are saying Medicare for all. But as far as I can tell, there's only one who is actually talking about what you're talking about. Maybe I'm wrong, but that's what I'm hearing. Now, okay, but what I'm asking about is everybody saying Medicare for all. How should people tell the difference between somebody saying Medicare for all and it really being what you're talking about?
Thank you. Thank you. Alex, do you want to comment?
Yeah, it's a great question. I have a few different answers to it. One of them is there's definitely two people running for president who are fighting for Medicare for all, Bernie Sanders and Elizabeth Warren. They definitely are. It's just, now, how do I know that? You actually have to listen to them. And I mean that. You have to actually listen to them because none of us can look into a person's heart. What do I mean by that? As organizers, I learned this actually, Marion Barry told me this. It was a wise counsel of his organizing on public health and HIV policy in the District of Columbia a long time ago. And he told me, don't punch a person in the face when they're walking towards you. And what he meant by that is that we'd been advocating for free condom distribution, and there were opponents of ours who'd been against us, but then they turned, and then they were with us. And a lot of activists were like, you can't trust them, right? Just sort of understand that. You can't trust anybody, right? This is about power. And all power comes from the people, so trusting politicians is a sucker's game. But when someone does come towards you and says, I'm now with you, don't punch them in the face then. Welcome them. You want them there. When Cory Booker said he was no longer going to take pharmaceutical money, that was huge. I won't hold him to the fact that he used to take it. I mean, I know he did, but now he doesn't. I want him over here. I want people to see that the path forward is to join with us, that the power is with us. And that we're welcoming. Now, on the other side, when someone's with you and then they turn on you, you have to hold them accountable for that. So like when Beto O'Rourke actually was for Medicare for all before he then decided that he was against it, we need to say, okay, well, I'm listening to you. You just told me that you're no longer for Medicare for all, and you have to hold people accountable then. But the key, what I'm saying is, we need to build. We need to be inviting, and we need to be welcoming as a movement to people. We need to understand the policy details and the differences, but we actually want to encourage everyone to be with us. We want everyone to sign on to the bill. Every time they make a statement, well, let's get them on a bill. If they're on the bill, let's get them on video saying that. Let's make them join the caucus. Let's deepen their support of it. But first, we want to welcome everyone and say, come on in. This is where the cool kids are. We're going to win.
And nobody's perfect, okay? I've been working with the Sanders campaign, and one of the things we butted heads on a couple of months ago was that we had a couple of people that were just absolutely convinced that Medicare for All would solve all disparities. That's not true. There's good reasons why that's not true, but if you listen enough, as Alex points out, you can dialogue and say, well, this is the part about that's true, and this is how we can move the thing forward, and this is how we can back each other up. And for those Democrats that are running, that we would all, everybody's got their preferences. It's an issue of including all the possibilities as we try to enlighten people that this ACA and other alternatives are not the answer. You can't just kind of, rip into them and say, you're ignorant, this is like a no, because there is a tiny, tiny portion of of truth in that including people in a healthcare system is important. The fact that you're not actually having 100% universal coverage is a whole nother issue, and it needs to be brought up.
I also want to say something to this, but I'm going to be real because might make some people uncomfortable. But there has been, sometimes we're talking to ourselves. We're in a room with among of just progressives talking to each other about what we believe in. It is time to make a concerted effort to go into African American communities, communities of color, like real, actual outreach. And I would say this because we're in Clinton. And if I walk out here and knock on doors here, you are going to see mostly African Americans, but they're not in this room. And that means they don't know about this. And that is honestly also part of it is because many of them don't know what Medicare for All is. I remember even knocking on doors because I know some of the organizations, I'm affiliated with NNU, and I started talking about Medicare for All. And this one was like, what is Medicare for All, sweetheart? I don't know what you're talking about. And, so I had to kind of explain it to her. But the point is that there's an education piece that's huge for us. And if we do not gather it now, I'm a part of Delta Sigma Theta. Has anybody, are we going to reach out to fraternities and sororities that have a massive number of constituencies in this area and talk to them about it? Are we going into Hispanic communities, hardcore? Are we going into African communities? I'm Liberian, Nigerian background. Are we going to them and saying support Medicare for All? We're not. And I'm saying that we're not doing that, and we're not making as big of an effort as we should. And then, we wonder why, parts of District 5, it's not even just that, the constituents want it, but a lot of the constituents, especially when you get around here, don't know anything about it. They know it. They've heard people talk about it. They've heard, actually, Elizabeth Warren. They've heard Bernie Sanders. But let me just tell you, some of them are not appealing to a large minority populations. So let's get some people at the top level who look like me that can say, I'm supporting Medicare for All, and start reaching out to their communities, and those people start hearing it. It's a big education piece, and I think we really need to make a concerted effort. And I would say I myself, too.
I just want to add that I live with 4 young adults, teenagers, 21, 18, 17, and 16. And my 17-year-old will vote in the next election. And so I'm telling her about coming here, and she's like, well, what? I thought Medicare for All was, that basically everybody gets to walk into wherever they want and they get what they want. And I said, well, let's sit down and talk about it, and let's sit down and talk about what they're proposing and what's going on. And she said, nobody's talking to us about it. And so I think that we also have a responsibility besides race, but also to look at age and to talk to the young people who are going to vote and need to understand this is the health insurance that you're going to inherit, that you are going to vote for. And oftentimes they're forgotten and they're not talked to enough. And we know that Bernie Sanders has the highest, young adult support, but it's important to ensure that we're talking to them as well. And On top of reaching into that community, we also have to reach into the disability community, because the disability community is full of fear. We have navigated. I worked with a mom who she had to appeal 3 times to get something covered that she thought was covered by law. And so it took months and months and months in order to fight an insurance system that she doesn't understand. And so we have to reach in and say, to you guys' point, this is what you get, and really help them understand that you can meet your child's needs and you can address them with Medicare for All. And I think that those 2 communities are really important for us to focus on top of minorities.
So it just reminded me of two quick things. One, we're not monolithic. So it doesn't matter what community you're talking about, we're not monolithic. There are conservatives, there are centrists, there are liberals, or whatever. That's irrelevant. What we have in common is no one wants to go broke because they can't get health care. That's outrageous. And that should be the kind of message that's going across from even the Sanders campaign. And yeah, the slogan M4A is good and solid, but it's not the most important thing. The most important thing is to communicate that everybody needs health care and that no one, regardless of your political position, and that you shouldn't be vulnerable to propagandizing. You know, if I tell you, hey, vote for me, I'm going to make sure your coal job remains intact, but then I can't actually do anything about it, then call it out and say, great, so you have your private insurer. How's that going to work for you if you get sick? What do you know about how it will actually cover or not? And to what extent will you be in the hole not covered? That's sort of my idea for how to get across, have these conversations across lines and across communities, regardless of people's backgrounds and political positions.
Thank you. I think at this point I want to thank all the panelists. It's been a really stirring performance. I think we have all learned a great deal. I want to thank you for your thoughts, your wisdom, your comments, and especially your reaction to all the questions that came. I think that really increased the conversation that we had. And my takeaway, I know I had a conversation with Dr. Gomez earlier, and I said, why are people not on the streets marching when there's so much at stake? And I was reminded of one of my friends who said to me, because it doesn't hurt enough. But I think it does hurt enough now. And I just want to echo what Bernie Sanders said, is we need a revolution. Because unless we're out on the streets and marching for all these and doing all the things that everybody spoke about, including Walla, who said we should be taking it into communities that haven't heard about this, I don't think we're going to move ahead with this. So with that, I'd like to move ahead to I'd like to give the panelists a big round of applause and thank them for everything they've done. I think we're going to ask you to clear the stage so we can move on to the next, yeah, thanks, Jessica. Yeah. Thank you. And to invite Christy to take over.
Is this on? Okay. So guys, we're going to transition into the next part of this. I want to start this out by directing everyone's attention to the sign in the back that says, Democrats against Medicare for All make me sick. And the reason why I want to direct your attention to that is the fact that we currently have a Congress that in large part is bought and paid for by the insurance and pharmaceutical industries. And let's be honest, they are not supporting these issues because they think truly it's a bad thing or truly it's going to cost too much money. They aren't supporting these issues because they know that they are paid for by the companies that do not want this to move through. So the reason why we even started this coalition, amongst the 20 some odd groups that we now have, we span across Maryland, we represent hundreds of thousands of people. And we have people in all congressional districts throughout Maryland. And as a healthcare provider myself, aside from doing this activist work, I can tell you that I could fill a book with patient stories of people who have been harmed or maimed by insurance industry or the pharmaceutical industry, okay? And so we know that we have the grassroots power and we have the stories on our side, and what we need to do now is get the congressmen to stop taking corporate PAC money. Steny Hoyer is one of the biggest offenders of this. He's taken more corporate PAC money and more healthcare sector PAC money than most congressmen over the course of his career. It's completely unacceptable. He does not work for the corporations. He works for the constituents of District 5, okay? And so when we move on and we talk about this, I want to offer you the opportunity to tell Congressman Hoyer your healthcare story. If he were to be sitting in this chair right here, what would you say to him? How would you tell him what you've been through? And so I want to invite people to speak and tell their stories.
Thank you. Steny, I attended your birthday party this year, and we had a discussion. Then today I got this letter from you, the last paragraph of which, page 1, says, we need to chart a course to give every American an affordable coverage option. That's the language of for-profit insurance. When I talked to you at your birthday party, I pointed out that no insurance company has ever healed a wound or cured a sick person, and you seemed puzzled. When I mentioned to you that if we all chip in and provide health care for each other through Medicare for All, nobody needs insurance. And you again looked like you either didn't understand or didn't want to understand. So I went in and looked at your campaign contributions, and up until 2006, you got several hundred thousand dollars from the health racket. But in 2008, that jumped up to over $1 million. In 2010, over $1 million. In 2012, even more, over $1 million. 2014, over $1 million. 2016, over $1 million. 2018, over $1 million. And 2020, we've just started, and you're well on your way to cracking the $1 million. So my healthcare story is a frustration with you raking in so many millions from this industry. You don't even bother to ask me for campaign contributions. You certainly don't need them from me. Is there a connection between your opposition to Medicare for All with your insistence that for-profit insurance companies get to stand between us and our healthcare providers? Is there a connection between that and the multi-million dollars they pay you to be a majority leader?
Hello. Oh, hi. My name is Michaela Wilkes, and I just want to share my story regarding the broken healthcare system. So I've been a resident of Maryland my entire life. I've been represented by Steny Hoyer for about 2/3 of my life. And when we talk about disparities in the healthcare system, right, with people of color specifically, I was about 6 or 7 months pregnant with my daughter at the time when I went to the emergency room for the 3rd time, actually, after being sent away after complaining about shortness of breath and being tired from pretty much doing nothing. And they just kept sending me home as if I was a hypochondriac or because it was my asthma. I know what an asthma attack felt like, and that wasn't it. I found out that I had deep vein thrombosis. I had a blood clot behind each knee and one in my lung. I had no idea what this meant, and it scared the crap out of me when I found out that I could die from that. So it wasn't only my life in jeopardy, but my child that I was carrying, and then also having to leave my son behind who's right here. It scared the crap out of me, and I was even more scared after finding out that my insurance company was not going to cover my medicine. My physician in the hospital decided to admit me because that was the only way I would be able to get the medication. And all of the doctors that were working with me had to argue with my health insurance company, like basically telling them she needs this medicine or she's going to die. And if you guys don't cover her medication, then we're prepared to keep her in the hospital for the rest of her pregnancy to make sure that she gets this. And that was just really scary to me. And just, I couldn't believe that I was going through that. Like, I might die from this, and you guys are arguing about the cost of how much it's going to cost. So I ended up being in the hospital for about 2 weeks. I guess my insurance caved in. I don't know what my doctors did, but thank God for them, because I'm still here today. And this isn't just a one-off issue for me. This is a continuous issue. I was diagnosed with hypertension, which means I have high blood pressure. And right now, I'm rationing my sorry, I don't want to get emotional. But right now, I'm rationing my medication. I have about a week or two of supply left, because of the restrictions from private insurance with the co-pays and the deductibles and the premiums. And so I can't get to my doctor's office to get a refill. I have no more refills left. And so I'm pretty much rationing my medication, stretching it, taking aspirin here and there, skipping a day or two on taking my medicine. And this is one of the reasons why I am running to primary Steny Hoyer, and why I'm running to represent people of Maryland's 5th District, because we shouldn't have this as our reality. Like, we need a reality where we're not rationing our medication. My cousin almost died and is vision impaired for the rest of her life from rationing her diabetic medication. I could have a stroke or a heart attack from rationing my blood pressure medication. We need a reality where this isn't happening, where doctors don't have to argue with our health insurance companies to save our lives. That shouldn't even be an issue. And in our current and our current representation is not on the forefront of this issue. We need Medicare for all, and we need it now, because I'm scared to death, and I know everyone else is. And that's my story. Thank you.
Thank you so much, Michaela. I want to add here that when insurance companies deny your care, they're doing so because they hope that you die and then they don't have to pay for you anymore. Insurance companies in no way have any concern for your health. If you are a sick patient with health conditions, that's a problem to them. That eats into their profit. So I've seen again and again, and I'm sure the physicians that were on the stage have seen again and again, where they continue to deny care because they hope that you die off or you just stop wanting to fight with them. So, does anyone else?
My name is Evan Papp, and I live in Riverdale, Maryland. And Steny Empty Chair Hoyer is my representative. Last year, my father's Parkinson's got a lot worse, and my mother, as his caretaker, had to put him into long-term care. And as she was supporting his last months, she was wrestling with the fact that she's going to lose all of her savings in long-term care. Before he passed away, so I have a few notes here. So before she went bankrupt, he passed last April in long-term care. And this story is not unique in America. 2/3 of American bankruptcies are tied to medical costs. And improved Medicare for all would support long-term care for people like my father, but also family members and caretakers. So in February, I asked Congressman Hoyer if he would support Medicare for all. And he rambled on about saving the Affordable Care Act. He's the #2 Democrat in Congress. He has the power to lead. Yet when so much of his funding comes from health insurance and Wall Street finance, it is hard to not see what he is loyal to. Mr. Hoyer, do the right thing, support universal health care with improved Medicare for all available to all Americans. Thank you.
Thank you, Evan. Does anyone have another healthcare story?
Okay. Hi, my name is Drew, and this one's pretty quick, but this past week on Wednesday, my dad had his second surgery related to prostate cancer of the year. And fortunately, my family, we have one of the quote-unquote good insurance plans, but as a result of two pretty major surgeries, we've hit our out-of-pocket maximum for the year. And my mom is very excited because that means all of the not necessarily life-threatening procedures that she needed to get done, but procedures that she had said, oh, this would probably improve your standard of living, or you might want to get this checked out or done sooner rather than later. She's just in a rush to get them all done before the end of the year. And we have one of the good insurance plans. My dad, when he got his current job, it was, wow, this is one of the best private insurance plans I've seen from any employer I've ever had. But just, we were talking about earlier just how complicated the insurance industry is and how much private insurance doesn't want to pay for you right away. You have to do all this stuff, and I just think be a lot simpler if I need something done, need something checked out, I can just go to the doctor and get it done, than wait until I have a life-threatening thing that I can't put off before I can do any of the other things I need to get done.
Thank you.
Hello. Stenny. You've got to start being a leader on healthcare because it's terrible that you have not stepped up. I want to tell a very quick story. I had a terrible accident, and I had health insurance, and the Kaiser Permanente denied me coverage. All this happened while I was in a coma. The reason they denied health care was because I failed to present my Kaiser Permanente card when I checked into the hospital. But I arrived by helicopter, and I was in a coma. So, obviously, Stenny, it's not working. There was a battle, it all happened, and I did get coverage. But if my support system hadn't battled, who knows what would have happened, because it took me a really long time before I would have been able to fight for myself. And so I'm just appalled that we have a congressperson who could take leadership on this role and has failed to do so.
Does anyone else have a story?
I'm 73 years old, Stenny. The last time I was in a doctor was when I was 60. I am fortunate that I am still reasonably healthy, although, I need some new knees. And I don't have insurance. And why don't I have insurance? I have access to insurance, it's wonderful to have the access. But we know what that means. The access means that if you pay for it, then you can get it. And I cannot afford it. So I am doing my best to be healthy. So far, it's been working. But at some point, it's not going to work anymore. It's been too long since I've been to a doctor. So, Stenny, you owe it to all of us to not give us access to health care, but to give us health care.
Hello, Congressman Hoyer. I'm Liz Anagonio. I write to you a lot. I call you a lot. I don't get a lot back from you. I'm rather disappointed in that. I'm going to speak as a healthcare provider to show a few of the many stories I could tell about the difficulties families have. Specifically, I worked with children and adolescents with disabilities and their families. I cannot tell you how many times families that had good insurance or the Affordable Care Act were turned down for services, or worse yet, I have my child with autism who's having a meltdown on the floor at this appointment, and the provider, me, says, we need a blood work for this to better treat your child. Oh, but whoops. We can't do the blood draw here because your insurance family says that you have to go to somewhere else with your child with autism while you're missing work and dragging this poor child around, where we have a lab right next door to the treatment room with a child specialist that could help that child get through the blood draw. But no, the family has to take another day off work. They have to go somewhere else far away. They have to take that child with autism to yet another strange place to get an unpleasant procedure done so that I can have the information I need to treat that child. That is not health care. The thing that I think we need Medicare for All to solve is that fragmented care where to get one thing done, I, you, everyone in this room, and the parents of those children have to do is go to 5 appointments to get one thing accomplished. It is unacceptable. It is not health care. And the other thing that happens is that because one little portion isn't covered in this particular clinic, oh, by the way, that healthcare provider looked in your ears. We don't cover an ear exam for a well child, except if it's a well child thing. So now the family's going to pay for an ear exam because we did a comprehensive exam for that child. Medicare for All, universal coverage, no paying, and furthermore, unity of care, because every provider will be part of that system. Thank you.
Thanks, Liz. So we are going to transition into the next part of this, and we'd like you guys to watch the video that's going to pop up on the screen.
You say that you support universal health care. Why do you not support Medicare for All?
Because Nancy and I, the Speaker and I, worked very, very hard with President Obama to get the health care plan in place.
No, that's not a health care plan. That's a health insurance plan. Nobody who has health care needs health
didn't
insurance.
come to argue. Thank you for being here.
I'm just clarifying.
I'm very pleased that you're...
No insurance company has ever healed any sick person, right? The insurance companies don't provide medical care.
I didn't come here to have all you guys think. I came to you thanking you for participating and making a good point and being for health care.